it's already up. Okay. Where's my book? Okay, if you look at this third bullet up here, well, let's start with the second one. Understanding muscle movements also depends on knowledge of skeletal anatomy. So, in order for you to understand the movement of your muscles or the actions or the functions of your muscles, you're going to have to know your bones, okay? The next lab exam you guys are going to take, which will be in April, it's going to be a combination of your synovial joint movements, where you're going to have to do flexion, extension, abduction, adduction, things of that sort. And then you're going to have to tell me which muscle allows you to do that movement. Because every movement that we do, muscles allow us to do that, because muscles pull on the tendons in order for movement to what? Occur. So, knowledge of skeletal anatomy. So when you guys, you do it individually, you come before me. I normally take 2 students at a time, and I also do flexion and extension of the elbow joint, okay? What allows you, and I ask, and I tell the students to palpate. I says, okay, palpate on you what action allows you to do this movement here. Okay, this muscle here called the biceps brachii will allow you to do that. And then I say, okay, now do extension of the elbow. You extend the elbow, what muscle allows you to do that? Your triceps allow you to do that, all right? When you do this movement here, and those of you that work out, you know, you're working muscles when you do a lot. We do these movements every day, especially if you go to a gym. You're doing this, you're doing bicep curls, you're doing tricep kickbacks. Muscles, you're trying to tone up what? The muscles, right? So if you don't know your muscles or where they're located, then you're going to be in a pickle. If you don't know your bones, you're going to be in a pickle also. So that's important. Position, shapes, and processes of bone can serve as landmarks for clinicians, which we're going to talk about, because there are certain bones that do serve as landmarks for clinicians, like the pelvic outlet, which is that big hole. I didn't bring the skeleton in here. That big hole that the baby has to come out of. Okay, that's you have a pelvic inlet and a pelvic outlet between the hips. When you do CPR, cardiopulmonary resuscitation, the sternum, of course, is your what? Your landmark. You need to know where that bone is, right? Okay. Landmarks for clinicians, that's important. And being in the nursing program, you have to know this information too. So this is not an articulated skeleton that's all put together. If you guys, you know, it's not cheating. A student asked me the other day, well, can I walk up and look at the articulated skeleton? I said, sure. So if you get over there and you're not sure about a bone, you can look at one of the articulated skeletons. You know, I mean, I don't call it cheating, but, you know, it's fine with me. Here, okay. We've talked a little bit about the axial and the appendicular skeleton. The axial skeleton, of course, is your central axis, which is the middle of your body. You have your head, your neck, and what? Your trunk. You've got your ribs involved, the sternum involved here. Of course, you've got the vertebrae involved, the sacrum, which is this big bone right here, and the hyoid bone. Okay. Appendicular skeleton, of course, is in green. You have your appendages here. You have a pectoral girdle, which you need to be familiar with. Pectoral girdle. Pectoral girdle, guys, consists of the clavicle and the scapula. They make up the what? Pectoral what? Girdle, to allow the humerus, the radius, the ulna, the upper extremity or the arm to attach to that. And then, of course, with your lower body, you have the pelvic girdle. Pelvic girdle, or the pelvis, that's where you're going to have the hip bone right here and the sacrum, okay? So allows the lower limbs to attach to your what? Your hips. You got it? This is the sacrum, this hole right here that I was telling you about. This is your pelvic inlet and the pelvic outlet that the baby has to come through when it's being born. When it's coming out. Okay. So let's do a quick rundown before I move on. Wish I had a pointer. Start at the top. Name the bone. Okay. This flat part. The acromion, right? What part of the clavicle attaches to it? Which end? Which end? The acromial end, right? The flat part goes just like that, right? What is this end called? Why? It's attached to the sternum, right? Okay, good. This little, they call it a bird's beak. It resembles a bird's beak. This little part here is called what? The coracoid process. Okay, I've been marking a lot of these wrong. Students have been calling this one the coracoid process, and they've been calling this one the acromion. Okay, and they've also been spelling it wrong. They've been calling this the coronoid process. I told them there is a coronoid process, but it's not on the scapula, it's on the humerus. All right, so coracoid process. Now, another thing, you guys have a word bank, right? If you spell your words wrong with a word bank, I promise you I've got to mark. I would not be able to sleep tonight if I did not mark it wrong. I would be doing you a disservice if you got a word bank, the words staring you in your face with the correct spelling, and then you spell humerus, Humerous, when it's clearly on your word bank, Humerus. Okay? You spell the calcaneus, Calcaneus. I'm like, where is that O coming from? I was like, is it like that in the book? Did I spell it wrong on the study guide or something, the word bank? But I'm like, it doesn't even sound like an O should be in there. Calcaneus, us, humorous. But anyway, gotta mark it wrong. What is this? The tibia, right? If you spell it T-I-B-U-L-A, I'm marking it wrong. Tibula. They've been calling this the tibula. Tibula. And I know these two sound alike. Which one is this one? How do you spell this one? Okay. They've been calling this the fibia. Marking it wrong. I mean, just simple mistakes, killing their grades. You better pay attention. I'm telling you. What's the lay term for this bone? Shoulder blade. Not the shoulder bone, but the shoulder blade. It's not called the shoulder either, guys. Guys, this is your shoulder here. This is a bone. It's called the shoulder blade. Okay? Moving on. Need a pen. A color, right? This flat part is called the pointed end. Okay. What part of this bone does it attach to? Right there, right? Okay, good. Yeah, this part right here. Okay. What nerve goes through here? Okay. Acetabulum. 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 What bone is here? What part of the femur? What's the lay term? The what? The butt bone. If you put butt, I mark it wrong. It's called the butt. This is a bone. Not just the butt, but the butt what? Bone. Okay? Now, moving on. So we're going to keep going through these as I go through the chapter. Is that helping? Sure it's helping. Good. Calcaneus, right? What's the lay term for this? The heel bone. Okay? Right. Metatarsals, right? Wait, proximal what? If you put proximal, I'm marking it wrong. Do you have a middle in your thumb? Okay, good. On your word bank, you probably see this word here, phalanx. I think I was seeing it last Saturday, and some of y'all were looking at me strange, like, what? Okay. Phalanx, of course, is going to be singular because you're talking about one finger or one toe. Okay? Finger or toe. So when I hold up one finger, you have what? Your proximal, your middle, and your distal phalanx. Phalanges, you're talking about all of them. It's plural, right? Okay? You're talking about all of your fingers and what? Toes. Phalanx, you have one. I think on your word bank you have the word phalanx. I don't think you have phalanges on there, but just wanted to bring that to your attention. I've been marking it wrong. Y'all are the last group taking this test. If they're marking just proximal, putting just proximal and not being specific, I mark it wrong. Proximal is just a directional term. Proximal what? You're proximal to me. You're proximal to those bones. Distal? Distal what? You got to be very, very specific, guys, when it comes to these that test in there. Because make sure all of your I's are dotted and all of your T's are crossed. Okay? Hey guys, this file was too large to put on Blackboard, but if I have it on Jump Drive. If you want a copy of, bring a Jump Drive. Number of bones. There are 206 in your typical adult skeleton. There's what we have: the sesamoid bone, the patella, which is your kneecap. We know it looks like it's shaped like a sesame seed, which is why they call it a sesamoid bone. Okay, there are other sesamoid bones in the body too that I'm going to show you. Your metacarpal bones has a sesamoid bone, particularly the metacarpal bone of your thumb. It has a sesamoid bone. They form within some tendons in response to what? Stress. So if you're putting a lot of stress, which you do on your knee, of course, that's why it's considered a sesamoid bone. With your hands or your fingers, a lot of stress on it can cause those sesamoid bones to actually form. You also have Warmian bones that are typically found in the skull. I know one in particular is your lambdoid suture. So next week, you're going to be tested on the skull. All right. I think this is my number right here. This little suture right here, you have little fragments of bone that will actually form around this suture, your lambdoid suture, which are called Warmian bones. They're little fragments, bone fragments, okay? Extra bones that develop in your skull suture lines. Sutures, guys, are joints that hold the skull bones together, okay? So it's in your textbook on page... page 236. You need to highlight that. They're joints, immovable joints that hold the skull bones together. There are 270 bones at birth, but they decrease with fusion. One in particular, okay, this bone right here, babies are born with, they don't have 206. We have 206, as an adult. Adults have 206. Remember we talked about ossification, bone formation in the previous chapter. Like, for example, this bone right here, the patella, is not completely ossified. So at birth, this bone is still developing. It's not completely ossified. I think it's completely ossified between the ages of 3 and 6 years old. All right? So they don't have a mature patella at birth. Another bone, of course, I should have brought the skeleton in here. If you look here, this is a fetal skull here. This is an adult skull here. If you look here, right down the middle, okay, it's a frontal bone. Looks like they have two, okay? This bone has not completely fused, becoming one. However, for us, if you palpate your forehead, that's your frontal bone. This bone right here, this is the frontal bone for us. You don't see a line going down the middle because it's completely formed. Remember, the intramembranous ossification is responsible for the formation of your skull and the clavicle, right? So the process is still going on when babies are born. The sacrum, if I go back, this bone right here, this is the heaviest bone of the vertebral column. You can see the 5th lumbar vertebrae, sacrum. I should have brought one in here. Your sacrum right here is very heavy. It's the largest. It supports the other 33, the other vertebrae that you have above it. This one does not start the ossification process until the age of 20. And, of course, it should be complete by the time the person is 26 years old. So if you have not reached the age of 26, your sacrum, of course, is still going through the transformation process. The same thing with this little bone right here. This is called your coccyx, which is your tailbone, okay? It has not completely what? Formed or what? Ossified, okay? Okay, on page surface markings, your table 8.2, ridges, spines, bumps, depressions, canals, pores, slits, cavities, and articular what? Surfaces. I should have put more of these bone markings on your test because they're really, really important. Tendons, ligaments, of course, are attached to those what? Those bone markings, which of course is very important. Didn't put enough on there, so I probably should change the test. I've been saying that for the last couple of semesters, but I haven't changed it yet. So if you turn over to page 236, table 8.2, bone anatomical features of bones. It is important to know the names of these bone markings because later descriptions of joints, which is chapter 9, guys, muscle attachments and the routes traveled by nerves and blood vessels are based on this what terminology. Terms of the most common bone features are listed in table 8.2 and several are illustrated in figure 8.2. Condyles, okay, a rounded knob that articulates with what? Another bone, okay? Who knows where the condyles are on the femur? Does anybody know? These little rounded knobs here, right? You have, this bone goes like this in your hip socket. So this will be your medial what? Condyle, and this will be the lateral what? Condyle, okay? And it sits on top of which bone? Tibia, right? Okay. So here, this is the medial condyle for the tibia. This is what? Your lateral condyle. Goes just like that. Epicondyles sit a little bit, these little bumps on the side right here are called your epicondyles. They sit a little bit above what? Your condyles, okay? I know you guys know what this is, right? What is this? The greater what? Trochanter, and this one is the lesser trochanter. When does this outgrowth occur? We talked about it with Wolff's laws. When the babies start walking, right? Remember, this is all smooth. It hasn't formed yet. Remember, this is the largest bone in the body. It's your thigh bone. Supports the weight of the body. So the moment that baby gets up and stands on its hind legs, its legs, and starts walking, the tendons on those thigh muscles, your quads and your hamstrings, are going to start pulling on this bone, and this is where you get these little outgrowths. Looks like little rough features, okay? You have your greater and what? You have your what? Your lesser trochanter, okay? Spines. Who knows where the spine of the scapula is? This part right here. This is called the spine of what? The scapula. It's a long, slender bone. You have the spine of the mandible, okay? Spine of the mandible, which is, I brought this one in here, which is kind of like this part right here of the what? The mandible, all right? Moving on. Head, a prominent expanded end of a bone, sometimes rounded. Which bones has a head? Femur, humerus, and radius. I'm waiting. The ulna, and what else? Well, yeah, they do. They have a head, a body, and a base. The ulna, right? Yep, the ulna has a head. Okay, but the more prominent ones would be the humerus and, of course, the femur. Process, any bony prominent, your mastoid process of the skull. If you palpate behind your ear, you can feel the mastoid process, which is going to be on your exam next week. Protuberance, a bony outgrowth or protruding part. Mental protuberance, if you look on page 237, figure 8.3, the pointed part of your chin, guys, of course, the scientific name for that is called the mental protuberance. Next week on your exam, the skull, this little bump right here is called the external occipital protuberance, which is on the occipital bone. Sometimes it's a little bit more prevalent on some people. You know, you can just kind of see it poking out from the occipital bone. But this little bump right here is called a external occipital protuberance for the occipital bone. Okay? Trochanter, we've gone over that. Tubercle, greater and lesser tubercle of the humerus, which should have been on your test. What do you think those are, greater and lesser tubercle? Who wants to take it? Who wants this? Who wants it? Raise your hand. You want it? Shamka? It's a little outgrowth. Yeah. Right? Which one is lesser? Yeah, exactly. Greater, lesser. The lesser one sits a little bit below the greater. Greater what? Lesser tubercle. What part of the humerus is this? It's too early in the morning to be giving me wrong answers. Medial epicondyle. What's the lay term for it? The ha-ha bone. So if this one is the medial, which one is this one? Lateral. Exactly. Medial epicondyle. Let's turn over to page 261. Someone read that second paragraph where it says the distal end of the humerus. Don't everybody read at one time. Capitulum.
The lateral and medial epicondyle. The medial epicondyle protects the ulnar nerve which pass close to the surface across the back of the elbow. This epicondyle is commonly known as the funny bone because striking the elbow on the edge of the table stimulates the ulnar nerve and produces a sharp hitting sensation. Immediately proximal to the epicondyle, the margins of the humerus are called the lateral and medial supracondylar ridges. These are attachments for skeleton or arm muscles.
Good. Okay. So now you know that the medial epicondyle is called the funny bone because of that ulnar nerve. Okay. You have an ulnar nerve, guys, and it makes sense because you got to know your bones. You know, the ulnar bone, of course, is on the pinky side, right, which is right here, and you know your medial epicondyle is here. So that ulnar nerve is going to come right through here. It's going to kind of cross over by the elbow. So when you bang your elbow, okay, on a hard surface or a table or something, you're going to feel that tingling sensation that can radiate up your thumb and your arm, and you feel that sensation in your fingers as well. Over here, you have the radius, right? You have a radial nerve. The radial nerve right here, of course, is going to run through a little groove. So the radial nerve is responsible for when you extend your arm, okay, sensation for the radial nerve allows you to do this movement here, extension of what? The arm. She just mentioned condyles. You have the capitulum, which I should have put on your test, which are this little round part right here. And you have the trochlea, which is actually right here. Now, the capitulum, of course, is in direct contact with what? The radius. This little cup-like depression right here is called the trochlear notch. Okay? So the trochlear notch goes like this, and it articulates with what? The trochlea, which is this part right here. All right? Now, what is this? The olecranon, right? What's the lay term for that? The elbow. This little pointed part, styloid process. What's the name of this bone? The ulna. What's the name of this bone? Okay, good. Okay, let's go back over. So you can see now. Let me just, while we're over here, let's look at the humerus. Okay, so you have the surgical neck. You've got the anatomical neck. Guys, that surgical neck, of course, is the one that's most commonly fractured in the humerus. You've got the deltoid tuberosity. Now, if you look at the anterior view of the humerus, you do have a coronoid fossa. That's where students, instead of putting the coracoid process for the scapula, they were putting the coronoid fossa. And I'm like, okay, there is a coronoid fossa or cavity, but it's not on the scapula. And as you can see, it's on the front part of what? Of the humerus, bless you. And of course, on the scapula, which looks like a little bird's beak, if you go over to page 261, you can actually see what? The coracoid process. Coracoid process. Your biceps brachii, the muscle that allows you to flex the elbow, of course, that tendon attaches to the biceps brachii tendon, attaches to the coracoid process of what? The scapula. All right? Pores, slits, things of that sort. Okay, let's go back to table 8.2. 8.2. Moving on. Trochanter, spine, tuberosity, tibial tuberosity, which is that little bump you can palpate on the tibia. A tooth socket is called an alveolus. Foramen, a hole through a bone, usually round. Foramen magnum of the skull, which is going to be on your exam next week. This bone, this hole right here, remember a foramen, of course, is a hole where nerves, arteries, veins, and blood vessels travel through. But in this case, your spinal cord is going to... this is the second largest hole here. And the largest hole, of course, is going to be on the hip bone. This hole right here is called the obturator foramen. Obturator. Think about operator, obturator. O-B-T-U-R-A-T-O-R. This is the largest hole. The foramen magnum, of course, is going to be your what? The second largest hole. Okay? Tooth socket. My friend here, if you look at his mandible, he has several teeth that have fallen out. Okay? The little hole that you see is called the alveolus, which is the socket that holds what? The teeth. All right? Sinuses, meatus. Moving on. Okay. Yeah, they're showing you this patella, which is a sesamoid bone. Here, if you look at this thumb right here, sesamoid bone of a teenager's thumb, like I said, when there's stress put on a bone, a little sesamoid bone is going, looks like he's got two. They're little P-shaped structure. This is one in an adult. This is one in a teenager. They have two. Now, these are going to fuse together, creating the one that you have in an adult. You also have them in the rest of these metacarpal bones as well. Okay, so while we're over here, which carpal bone is this one that's connected to the metacarpal of your thumb? The what? The trapezium, right? Which one is this one? Scaphoid. Capitate. It's kind of hard to see that, isn't it? Which one is this one with the little hook on it? The hamate, right? Okay. Look. Which is the round one? This little peach-shaped one. The pisiform, right? He said the hamate. The pisiform. So the pisiform is attached to this one right here, which is called what? Traquetrum, right? Traquetrum. Which one is next to the trapezium? Trapezoid, right? So you got three T's. Trapezium, the trapezoid, and traquetrum. Traquetrum, somebody's name probably. I said, just think about somebody's name. Somebody has named their child Traquetrum probably today. Okay, here are these little Warmian bones. Now, next week, guys, these are your sutures. I like this one better right here. This is your lambdoid suture right here. That connects the occipital bone, which is this big green bone right here, to the right and left what? Parietal bones. Those little jagged edges that you see on the lambdoid suture, those are little Warmian bones. They look like little fragments of bones. That's what they really are. This suture right here is your what? Your sagittal suture. Okay? So there are 4 sutures that are going to be on your next. Ways to study bones. I kind of told you guys about this, how to study the bones. Okay, let me just bring this home to you. Page 236, the top of page 236, the second column, someone read where it says you will probably study both.
You will probably study both articulated skeletons, dry bones held together by wires and rods to show their spatial relationships to each other, and disarticulated bones. Bones taken apart so their surface features can be studied in more detail. As you study this chapter, also use the self-legend model. You can easily palpate, feel many of the bones and some of their details through the skin. Rotate your forearm, cross your legs, palpate your skull and wrist, and think about what is happening beneath the surface or what you can feel through the skin. You will gain the most from this chapter and indeed the entire book if you are conscious of your own body in relation to what you are studying.
Yep. So that's why I was telling you guys, start with the one that's already put together, the articulated one, and then study the disarticulated ones, which are separate, okay? But as she just stated, you're going to, especially if you're pre-nursing, guys, you're going to have to know your body. You're going to have to know your body. I mean, just in general, you need to have a really good understanding of your body. So just as Miss Sam's just read, you're going to have to palpate on you. That's why, okay, let me palpate the styloid process of the ulna on you. Let's see where you guys see. Students always up here. That's not your style. When you got the ulna, which is like this, where's the styloid process? On the distal end. Students, no. Do not leave out of my anatomy course, telling someone that your styloid process is up here, because that is so anatomically incorrect. Okay? No. Where is it? Come on, guys. Palpate. Everybody palpate. I'm waiting. This little bone right here that sticks out, right? That's your styloid process. Okay? Where's the medial malleolus? See there? They're all up here, which is the kneecap. When this bone is right here, and the medial malleolus is on the distal end, which is another way you guys probably should have studied. You probably should have put the bones on you. So where's the medial malleolus? Yeah, Jessica's pointing to it. This little bump right here that you can palpate. So this is the medial. Where's the lateral? Right. Where's the tibial tuberosity? The tibial tuberosity. Wait a minute. Before look, I'm jumping the gun. Palpate the tibia on you. Is it medial or lateral? Medial. Okay. So it's over here, right? So where would the tibial tuberosity be? The tibial tuberosity, guys, is this bump, this little bump right here. Yeah. The quadriceps tendons attach here. So it would be like, if you go right below your knee, you can feel it poking out, which is right here. That's your way. Here in the tibial tuberosity. Okay? Where's the humerus on you? Look, everybody's looking around trying to see where people are pointing to. Where's the radius? Do it in the anatomical position. Okay, where's the radius? Okay, you guys stay in the anatomical position now. Okay. And where's the ulna? Melissa, why are you up here? Is that the radius over here? The ulnar is over here, right? And the radius is where? Over here. Where's the femur on you? Where's the fibula? The fibula is lateral. It's not medial. Which bone is medial? Guys, you got to know your own bodies now. Okay. Skull, the most complex part of the skeleton. And it really is, don't let those pictures get afraid of the picture. Okay, like next Saturday, figure 8.3, which is on page 237, the two pictures on page 238, the two pictures on page 239, and figure 8.6, which is on page 240, and of course the mandible, my friend, which is on page 248. Okay? Those are skull bones that you're going to study. And don't get, I know students get afraid when they see the one at the top of page 239, the inferior view. There are a lot of bones underneath the skull. So, you know, try not to get too afraid when you see those. Know how to spell them. Now, if I find a word bank, I don't think I've ever used a word bank for the skull. You guys had the opportunity of having a word. About the cranial cavity. So I brought this in. Okay, this open space that you see here is a cavity. The brain sits in here. Okay, and then you have these skull bones that's going to cover it up to what? To protect it. Okay, so you have the skull bones. I remove it. You have the cavity, and the brain sits where? In here. There are other cavities. We're going to talk about your paranasal sinuses coming up. This is like the spine of the mandible right here. Okay, paranasal sinuses. You have frontal, sphenoid, ethmoid, and your maxillary. Lined by mucous membrane and airfield lining the anterior portion of the skull, acts as chambers that add resonance to the voice. Okay, lined by a mucous membrane. Now, you know the mucous membrane secretes what? Mucus, right? Talked about it in chapter what? 5. Okay, on page 240. Okay, so guys, we have 4 sinuses. If you look at the lady on page, figure 8.8, it's showing you your sphenoid, your ethmoid, which is kind of like forms the medial orbital or walls of the your eyes. Of course, your maxillary sinuses, which are lateral to your nose. Your frontal, you can't see the sphenoid. You're going to have to cut open the skull in order to see the sphenoid sinus. And, of course, you have what? Your frontal sinus. Now, they're little air-filled chambers. Looks like they have little holes in them because sound has to travel through your sinuses, okay, lined by me. So you secrete mucus. If you have a cold or if you have a severe sinus infection, okay, pollen, of course, is probably going to start falling in a couple of weeks by the end of March. And, of course, people get allergies. They get sinus infections. I know I get my sinuses get inflamed. I have that inflammation going on. And, of course, you start secreting a lot of mucus, which is going to cause your voice to change. So when it sounds like your voice is muffled or you're in a tunnel, that's because the sound is not traveling through the sinuses like they should. All right? The sound gets obstructed, like it's cut off because of that buildup of mucus, which means the sound cannot travel through those little air spaces. So that's why your voice changes when you have a cold or if you have a sinus infection or something. The frontal sinus, not everybody has them. I have my frontal sinus because I get a lot of sinus headaches right here in the frontal bone. All right? Foramina. So highlight sinuses on your on page 240 because they're going to definitely be on your next exam. I've got to get the study guide together so you guys will have plenty of work to do over spring break, which of course is the following week, the last week in March. Okay, so you're going to have work to do over the spring break. Holes that allow passage for nerves and blood vessels, arteries, veins, of course, is a foramen or foramina, right? And you have 14 facial bones. Your facial bones are likened to, they call your facial bones like the front porch of the cranium, okay? Supports your teeth, your facial, your jaw muscles, and all of that. So we're going to talk about the temporal bone, the zygomatic bone, the nasal bone, the vomer. Those are all of your facial bones, okay? Moving on. So here they're showing you what your sinuses look like on an x-ray. That maxillary is big. This maxillary sinus, we're going to talk about the foramen rotundum and the foramen ovale. When we talk about the sphenoid bone, those foramens, of course, act as a second division nerve block. So when people have surgery on their maxillary sinuses, they have to go through the sphenoid bone, which has the sphenoid sinus, the sphenoid bone, and somehow it's associated with those nerves that run through the sphenoid bone. Okay. Now, as you can see, this is your ethmoid bone here, this green structure. I'm going to spend some time talking about it. It's pretty complex. It's the upper part of it. You can kind of see it in here. And, of course, this long plate right here, guys, of course, is your perpendicular plate. Out of all the facial bones, this one right here is the most delicate, okay? If that bone gets fractured, the ethmoid bone, of course, it can cause meningitis, or it can set up an infection in the brain. So if it gets fractured, because it's in the nasal cavity or a part of it is in the nasal cavity, a part of it is forming the medial walls of the orbit or your eye socket. If these bones get fragments like due to a blow to the nose, the fragments can go up to the brain. The cerebrospinal fluid in the brain is going to leak into the nasal cavity, and an infection will be set up, of course, with this particular bone. Also, if this bone is injured, it's responsible. There's the olfactory nerve associated with this bone. If it gets injured, and that olfactory nerve, of course, is severed or damaged, it's going to disrupt your sense of smell. You're not going to be able to smell anything, okay? So this one, of course, is a very delicate one out of all the facial bones. This one, the ethmoid bone, and, of course, the nasal bone, okay? So here's your cranium right here. I'm not going to talk about your frontal lobe, your temporal lobe, and your cerebellum, okay? That's what the floor of the skull. You talk about those in Anatomy 202. Hopefully you guys would take Dr. Tracy Wilson for Anatomy 202. They just hired him. Okay. Protects the brain and associated sense organs, meninges, the dura mater. The dura mater, guys, is like a connective tissue that's going to keep the brain from making contact with the skull. It's a protection around. The brain has to have a lot of added protection. When you guys take Dr. Wilson, you're going to talk about the dura mater. There's a PIA mater, and you have an arachnoid mater as well. Okay? Now, let's talk about the swelling of the brain. If you look at the skull, now you have a skull cap. Okay, I'm going to remove this. This is called a skull cap. Hence the name. The name came the skull cap. And then you have the floor or the base of what? The skull, which is here. So the brain is sitting in here, and then you've got the skull cap sitting on top of it. Okay, now, not a lot of room for the brain to expand, right? So people that get brain injuries or some type of blow to the cranium, it could be anything. It could be from a fall. It could be from an accident or whatever. Okay, that brain is going to swell. And what happens is, because the brain doesn't have a lot of space to expand in, a lot of the tissue is going to come out through the foramen magnum. Okay? It's going to come out through this hole. It's going to put a lot of pressure on the spinal cord. And, of course, it's going to be fatal. Typically, you're going to die from it. Okay? It's hard to control swelling. It's a buildup of that CSF, cerebrospinal fluid, and it's hard to control swelling. Once the swelling it's very, very hard for doctors to stop the swelling. So, like I said, the foramen magnum, of course, the tissue is going to go through it, and it's going to result in death. So you have your skull cap, which is called the calvaria, and you have your cranial base, which is this part here. So your skull has what? Two parts, right? You guys want to take a break? Okay, take a break. You can come up here and look at the bones on your break. Houses the pituitary gland, which secretes a lot of hormones. This picture is on your test next Saturday. Frontal bone. the cranium. Okay, so it starts here and goes back, and it connects to the parietal bone. Okay, of course, around it you have your coronal or your frontal suture. Right here, the zigzag line going across the frontal bone is called your coronal suture that attaches this bone to the two what? Parietal bones. Okay. You have a supraorbital margin. You can actually palpate it right above your eye socket. This part right here is called your supraorbital margin. A supraorbital foramen. A foramen. What is a foramen or a foramina? It's a hole, right? Okay. You're going to see a lot of these when you take your skull exam. It's a whole passage for nerve, arteries, and what? Veins. Okay? The glabella, this little smooth portion right here, right above the your nose, of course, is called the glabella. And, of course, you have your frontal what? You also have an infraorbital foramen right here, guys. You have blood vessels to your face that will actually go through this little hole right here. Also, any sensation from your nose and your cheeks, of course, there's a nerve that has to travel through here as well, the infraorbital foramen. Okay? The lacrimal bone, I'm jumping the gun a little bit. I could probably just talk about all of them without going through the PowerPoints. This bone, lacrimal bone, this little red shape, this is the smallest of all the facial bones. Remember that. Lacrimal. L-A-C-R-I-M-A-L. The lacrimal bone is the smallest of them all. Of course, it houses your lacrima fossa, which, of course, has your tear sacs. So your tear sacs secrete, or your tears are secreted in the lacrima fossa, which is a part of the lacrimal bone. The lacrimal bone is the smallest, about the size of your little fingernail on your pinky finger. Okay? That's how large it is. You got it? Frontal bone. Here's that coronal suture. Those sutures look like little jigsaw puzzles. Looks like someone stitched the skull together. Here's that temporal bone right here. First signs of what? Gray hairs. These two pictures will be on your test. Figure 8.4a, figure 8.6. Parietal bones, right and left. In pink, little zigzag structure right here is your what? Sagittal suture. Make sense? That connects the two parietal bones together. Okay. Sagittal, coronal, lambdoid, squamous, 4 sutures. The movable joints that hold the skull bones what? Together. Okay. Temporal lines, attachment of your temporalis muscle right here. You have a superior temporal line here. You have an inferior temporal line here. The temporalis muscle is this big fan-shaped muscle that's under the bone that you cannot see. It's going to attach here and here. This is where it's going to stop. Kind of starts down here and it goes up. That's one of your chewing muscles that we're going to talk about in Chapter 10. Temporalis muscle is one of your muscles of mastication. Like Shanika is chewing that gum, her temporalis muscle is contracting to allow her to chew that gum. Okay. That's what the parietal bone looks like. Parietal bone. Sagittal suture. Lambdoid suture, which is over the occipital bone. Squamous over the temporal bone. Temporal bone. Okay. Now, the temporal bone, guys, is pretty complex. The lateral wall and part of the cranial what? Floor. here's the lateral wall right here, parts of the floor of the cranium. You have a squamous part, a zygomatic process, a mandibular what? Fossa. Here, this little spine right here, this is your zygomatic process. It connects your zygomatic bone, which looks like an upside down T. Zygomatic bone, which is a sky blue bone, connects it to the temporal what? Bone. Okay? This one right here is called your cheekbone, by the way, the zygomatic bone. So you have your mandibular fossa. I don't think you can see it here, which is a little hole on the mandible. This is the mandible. This part right here, guys, the mandible, pay attention. The largest, now this one right here is the most movable facial bone, okay, out of them all, out of all the facial bones. When y'all are yapping, this is the bone that's doing the most movement, just talking away. Okay, now if I remove it, now he's got a malaligned mandible, which we're going to talk about. That word here, mandibular fossa, are these little holes, this little indentation here that the mandibular condyles have to fit in. So an upward blow to the mandible can force it out of position. It knocks it right out of this little fossas right here. Okay, so the condyles are here. They fit into what? The mandibular fossa, which is a part of the temporal bone. Okay, now we're going somewhere with this. We're going to start talking about joints in this chapter, because chapter 9 we're going to deal with what? Joints. So you have your zygomatic process, the mandibular fossa. You have your tympanic part. External auditory meatus, you have an internal auditory meatus. This is your external acoustic or auditory, either one. Of course, is going to go into the skull, forming the internal acoustic meatus. Mandibular condyles, the mastoid process. Of course, you can palpate behind your ear. That bump that you have behind your ear, guys, of course, is your mastoid process. Okay? That's what the temporal bone looks like. And like I say, the bridge between the temporal bone and, of course, your cheekbone, which is your zygomatic bone, is this process. Zygomatic process. Temporal, does anybody in here have TM syndrome? Okay. Mandibular joint. This is called a temporal mandibular joint. Now, a joint, guys, of course, is defined where two bones meet or articulate. It's called a joint, okay? Temporal mandibular joint. Why is it called a temporal mandibular joint? What two bones are articulating? The mandible and what? The temporal bone, okay? So if you have TMJ syndrome, which I think is on your next exam, you have that clicking or popping sensation when you chew. It's coming from right here between the temporal bone and the what? The mandible. You get the headaches. You get tinnitus, ringing in your ears. Okay? A lot of people can't chew gum. Get severe headaches. Yeah. I have a mild case, but it's not severe. So temporal mandibular syndrome due to the temporal mandibular joint. Oh, now you got a styloid process over here. What two bones? Okay, let me go back to reviewing. Wake up and pay attention. What two bones up here have a styloid process? The radius and the ulna, right? Okay. Did I bring them in here? Which vertebrae is this one? Huh? Can y'all see? Which one is the lumbar, my right or left hand? right here? Okay. Which one is this one? Okay. Goes like that, right? Okay. Which one is the thoracic and which one is the lumbar? Now, this is a trick question right here. You said this is the lumbar? You're absolutely right. They do, right? Go like that. These are thoracic vertebrae. You know how you can tell? The spinous process tilts downward. Spinous process of your lumbar goes straight out. Okay? On the test, there are two of everything. I have two vertebrae on my test. So which one is the thoracic and which one is the lumbar? What is this one? You're right. What did you say? They sure do. Same thing. Students were saying, but one is bigger than the other one. Of course. You go down your spine, they get bigger, guys. Even your thoracic, even your lumbar. Although one of these, if you look at the body, looks a little bit small. Well, these look like the same size to me. They look a little bit smaller than the other. They're still the same. You know how you can tell when you look at this? This is your giveaway right here. Yeah, the spine is what? Process. That's how you can tell. Of course, you know, this is a dead giveaway right here. We know this one is in your neck, right? Cervical. And also, we're going to talk about the spinous process. You see that little fork right here? It's bifid. Right here. It's like little pinchers. That little fork right here. That's how you know it's a cervical vertebrae. I always tell students, look at the spinous process. Don't look at how big it is or how small it is. Always look what? At your spinous process. Okay. Let's see. What's the correct name for C1? What about C2? Okay. Page 251. If you look at figure 8.18, the vertebral column, the features of the vertebral column, if you look at the vertebrae, okay, as you go down the length of that lady's spine, you can see that the body or the vertebrae are getting what? Larger. Okay? C1, of course, is your atlas. C2, of course, is your axis. It has that little dens, a little point at the top. Okay? There are 7 cervical vertebrae, and there are 12 thoracic vertebrae. That's why they have the numbers T1 through T12. Okay? Now look at some of those thoracic vertebrae. You can see that last one is much larger than the first one if you look at the body. The lumbar, you only have 5 of them. That's your lower back, L1 through L5. And, of course, your sacrum, of course, and your coccyx is part of the vertebrae as well. You have 33 of them if you count them. If you will look on page 254, they're showing you the atlas and the axis and what they look like. I always tell students, if you look at letter B, figure 8.24, that little ball or point that you see at the top, that's the only vertebrae that has a dens or an odontoid what process. That's your C2. C1 sits on top of what? C2. Okay, so you have condyles right here on the occipital bone. So it's called the atlanto-occipital joint. So this is C1 here. So the condyle sits on top of, the occipital bone sits on top of C1, all right? So when you're nodding your head up and down, it's rocking back and forth, rocking back and forth. It's rocking back and forth on C1, okay? However, when you twist your head right, left, that's your C1 rotating on top of what? C2, that allows you to turn your head right, left, okay? They're called pivot joints. You got it? Now, look on page 255. Look at the thoracic vertebrae, letter B, and the spinous process, how it's tilted downward. And look at letter C, process for the lumbar vertebrae, which is very, very blunt, and it sticks what? Makes sense, doesn't it? Guys, there are no ribs on this test, okay? Someone was calling the clavicle a rib. You have no ribs on this exam, guys. Okay, let me just talk about this and we're going to stop so you guys can get your mind right before you go in there. Okay, you have a mastoid heart. Like I said, that little bump behind the ear, really, really severe ear infection, mastoiditis. Now, you know I'm going to put that on my test because it's a clinical term that you're going to have to be familiar with. I don't know what page it's on, but you need to highlight. It's on page, well, where is it? No, because I don't. Oh, it's on page 243. Mastoiditis, inflammation of the mastoid process, prolonged ear infection, okay? Sometimes you or it's painful, of course, is your mastoiditis. You have fever, you got swelling behind the ear when you have mastoiditis, and it can be pretty severe. Mastoiditis, subject to infection and what? Inflammation, which can erode the bone and spread where? The brain. So that bacteria that causes the mastoiditis can actually, if you don't get it treated immediately, or if you have a really severe earache and you don't get it treated, okay, that infection can go up to what? The brain, and of course it can be fatal, or it can actually lead to what? To death, okay? Any type of infection that can travel to the brain, you're pretty much done, okay? It just depends on how severe it is or how long you wait, you know? So we're going to talk about this last part, and we're going to stop. Receptors for hearing. You have the vestibulocochlear nerve, which is cranial nerve 8, which is on page 240 book. Receptors for hearing and sense of balance. So that nerve is a part of the petrous part, okay? So if that nerve, the vestibulocochlear nerve, guys, gets severed or damaged, it's going to interfere with your sense of what? Hearing. And of course, that's that nerve that allows us to keep our what? Balance. So your balance is going to be off if that nerve gets severed or what? Damaged, which is right here. Cranial nerve 8. They got cranial nerve 7. Oh, and by the way, those nerves that you guys are going to talk about in 202, you're going to always have an abbreviation, CN for cranial nerve, and you're going to have to put, what do you call these? Roman numerals. Yeah, you can't put the number 7. They're always followed by what? Roman numerals. Carotid canal, you had a carotid artery that travels through the carotid canal. The carotid artery, if you're laying on your pillow, sometimes you can hear it pulsating, on your pillow. The carotid canal is a passageway. It's a passage for the internal carotid artery, which is a major blood supply to what? Brain. Happens to that artery if it constricts too much. The carotid artery, you have two of them, it can lead to a heart attack. The jugular foramen, which is a hole that the jugular vein goes through, you have a lot of blood traveling from the brain to the heart by way of the jugular vein. The largest blood supply comes by way of the jugular vein from the brain going to where? The heart. Of course, that jugular vein gets severed, you die immediately, because you're going to lose a large amount of what? Blood. So if you ever get in a fight and you hear someone says go for the jugular, please run for your life because they're trying to kill you. Okay? Jugular vein. Okay. Any questions? So we'll start with the occipital bone next week.